Hey everyone, welcome to the new athlete pain management segment of Pain Resource, where we'll be focusing on sports and athletes who deal with chronic pain. We're going to be talking to real professional athletes and getting their advice on chronic pain, treatments, and navigating the world of pain management. And what better way to start off than talking with former Denver Broncos wide receiver Vance Johnson, 1985 to 1995, part of John Elway's Three Amigos. I know you have a lot of things going on, Vance, that our readers will all probably be something there for everybody with the Addiction Center and Recovery Center you have opening up there in Vegas. Your life story. I'm sure the many, many injuries you've been through in your playing career from Pop Warner. Did they call it Pop Warner where you're from? All the way up until, you retired in the NFL. But you look like you're in great shape. So let's dig into that and let's see how you managed to deal with your chronic pain. But first, tell us about your center out there in Vegas.
Absolutely. Let me say this. I'm so excited to be on with Pain Resource. I'm really pumped up about what you guys are offering to the community and to the country as a whole, because I think it's something that's very important. And hi, guys. I'm Vance Johnson, former Denver Bronco, and had a chance actually from a very young age to have the dreams and goals to be a pro athlete. And for some reason, by the grace of God, here I am now. I even have my own treatment program. And so what we are doing is bringing people in that are, dealing with the mental health and addiction problems, which is really something that's huge around the country right now. So I'm just happy and blessed to be in a position where I can give back and be a part of the solution rather than the problem.
Yeah. So again, what our readers, we have a lot of articles on addiction, a lot of articles on mental health, which I know you guys are big on out there. But our main focus is chronic pain, and I'd like to circle back to the addiction and the mental health when we get there. But what I'm curious about, and again, seeing what greatest shape you're in, is your chronic pain history or your injury history through football from early on as a little kid all the way through high school to the NFL. So with that said, I guess my first question would be, what's the first injury that you sustained playing football that you can remember?
It's interesting talking about chronic pain, because when you're a young athlete, you don't talk about chronic pain. You don't even know what that word is. All you know is you have injuries and you have different pains, but for some reason you're able to sustain by making sure you show up to practice the next day, and being a young athlete, you heal really quick. But as time goes on, these major injuries that you have throughout your career, you don't think about the future and how it's going to affect you, but it's something that's serious and it's something that's real. So I need people to know, especially young athletes, if they're listening, that injuries early on are going to affect your career, and they're going to affect you even more so after your career. So I've had some pretty major injuries with my body. I've broken my ankle, which was probably my most devastating one, because they had to do a complete reconstruction of all the ligaments. I have a long plate with about 8 or 9 different screws. I've blown my kneecaps out. I've blown my ligaments out of my knees, my shoulders, all over my body. And I've had probably maybe 10 or 15 different operations to reconstruct different things. But the main thing is the chronic pain that I've had to go through for many years, which even now at the age of 57, I'm having to deal with and learn how to cope with. And so being a part of Pain Resource, I can't wait to ask you for some advice.
Well, with that said, if you had to pick one injury that has plagued you, up until this morning, a pain you woke up with this morning that you have to overcome daily, which one would that be? Would that be the ankle injury, or is there something else that you wake up every morning and go, well, this is going to hurt?
And that's another good question, because I think that whatever injury you sustain, that's the major one, it affects the rest of your body. And mine is my ankle, because that ankle injury and having to do a complete reconstruction kind of affects everything that I do, the way I walk, the way I grab things, the way I move, the way I sleep, because that pain is always there. And I have other injuries in my shoulders and my elbows and all over my body that are also affected. So it's really something that you have to think about and focus on every single day when you're living in chronic pain, to try to figure out how you're going to get through it, how you're going to cure it, or how you're going to be able to at least sustain. Because as you get older, and that's another reason why I stay in shape, because if I start just letting my body fall apart, the chronic pain would get worse.
So what do you find is your you wake up, you have that pain. What's the best method you use personally um, to get through the day, to get yourself through the day?
So what I do every morning is when I'm having these pains, and a lot of it is in my muscles and my joints and my ankle, I'm noticing that if ever I jump in the shower and take a long hot shower, and I'm talking a long hot shower, it actually kind of soothes me down a little bit, so I'm able to sustain throughout the day. But if I just get up right away and start moving around, and it really affects me, and it's very painful. And even sometimes I have to take an aspirin. So I used to take aspirin when I had headaches. Now I had to take aspirin when I have this chronic pain that I'm dealing with.
With that said, and then do you see a chiropractor or a masseuse or an acupuncturist, or is there any kind of treatment, whether it could be natural remedies or normal doctors or physicians, or like I said, masseuses or anything like that, or is it more? Do you use any type of alternative medicine?
In my career, we had many masseuses, we had chiropractors, and we had different ways that we were handling and dealing with the pains that we suffered with throughout our career. But the main thing was give me a shot so I can get back out on the field. Well, afterwards, I noticed that the only way I was able to cope with my injuries, because people didn't really talk to you as an athlete about what happens after your career, is I would take pain medications. And to me, that pain medication was a cure. No, that was not a cure, it was a lie. In fact, the injuries sometimes even got even worse. So it took a lot of time for me to start to realize that I had to do something personally to make sure I could cope and deal with the different pains that I was having because of the injuries with that chronic pain. So I would see chiropractors, and what I noticed when I would see a chiropractor or a masseuse, that everything would change in my body for a short time. I mean, and let me be really transparent here. I would even be able to go urine or poop better because I saw a chiropractor, or I had a chance to see a masseuse that made my muscles, that would straighten me out. So I did many different things after my career, especially to make sure that I was able to cope and deal with that chronic pain that I woke up with daily.
Well, and as I said at the beginning, is you're a very fit guy, so sure you work out at least a couple times a week. How does working out or the chronic pain? How does the chronic pain affect your working out? Well, what kind of routines are you able to do? What kind of routines are you not able to do that you wish you could?
When I first got out of the NFL, it was really important to me to keep my body in shape. And so I actually was twice as big as I am right now. And to me, that was just the way that I was going to be able to cope and deal with the pains that I was living with. But unfortunately, as the years went by, I started to notice that the pains got really a lot worse. So when I would see a chiropractor, or I would see a massage therapist, or I would see a doctor or physician to talk about the different injuries I've had and try to get them to give me some type of meds to deal with it, they actually told me, you know what, Vance? You have a lot of body mass, so you might want to consider changing your workout habits, because you actually could, re-injure those things that are bothering you right now with the chronic pain that you have. And so as time went on, I either stopped working out completely so that I could cope and deal with the different chronic pain that I have. Because when you have chronic pain, it just doesn't affect your body, but it affects you mentally too. And believe it or not, it affects your family. So I kind of go back and forth. I want to get back in shape again, but I'm having a lot of problems with the injuries. And so then I had to really start toning in on how I was going to work out. So now I have a structured workout and a pattern of my life that allows me to cope and deal with the different types of pains that I'm going through. I even changed my eating habits. So there are a lot of things you need to do to make sure that you can deal with the pains that you're having with the chronic pain.
That actually leads me to my next question for you. I was going to ask you if what you eat affects the pain you have. So if you eat junk food for a day or two, do you feel that that's reflected on your pain?
I love junk food. I was big on junk food, but I had to stop eating the junk food because I noticed that the pains were inflamed. I mean, it was like, and I didn't even know that it had to do with the junk food, but for some reason, what I would notice is whenever I stopped eating junk food, then the pain was not as bad, but whenever I ate a lot of junk food, it was worse. So I started noticing when I would drink coffee that things changed. When I started to eat a lot of vegetables, which even now I'm on a really strong vegetable diet where I eat different types of avocado and all different types of meals, that affects me too. And so your diet is really important. I also stopped eating red meat. And I noticed by stopping eating red meat that the pains have subsided a lot more as well. So I eat chicken, So your diet is probably one of the main things you need to do when you're dealing with chronic pain. The things you eat, alcohol. So when I was drinking alcohol and I struggled in my addiction, I had so much pain that I would have to use myself until I would literally pass out, not knowing that it was making it worse.
So you bring up your alcohol addiction, if you don't mind touching on that for a second. Do you feel, I know a lot of it, what happens with, you reach the success that you did, and, it's a high in itself. But do you feel that maybe the pain, the injuries you sustained, or, the medication you were given, do you think that maybe led to some of the addictions?
It's a very good question, because what happened after my career, when I wasn't able to see the NFL doctors who were prescribing these different types of opioids and different types of pills that were helping me cope with the pain I was going through, then I would see doctors to try to get drugs for myself, and I couldn't get them. And so I started leaning on different things like alcohol and other types of medications that I can get from someone that I didn't have any names for, but for some reason they were making the pain go away. But as the alcohol increased, I started noticing that I was in a lot more pain. It was really hard to sleep. So I would literally have to drink myself until I passed out. But I would wake up in the middle of the night like, oh my God, in so much pain, not realizing that the alcohol was causing it. And so you know what I would do? I would drink more alcohol so that I could pass out again. So, addiction is something that if you have chronic pain, that we try to take to make those pains go away, but it's doing nothing but making it worse.
Yeah, and addiction in itself is a chronic pain. I mean, that's something it's not just a technical term. It's they say that mental health and addiction go hand in hand. If you have one, you probably have the other, which would bring me into what you guys do over at the Vance Johnson Recovery Center. You deal with both there. You deal with mental health and you deal with addiction and recovery in that form. Do you have a dual diagnosis program there?
What's really interesting is you are very aware with what's happening with this, because you just triggered something inside of me. I forgot to mention that, over the last 2 or 3 years, I've had a chance to spend a lot of time being diagnosed through the NFL alumni and different types of leagues, with the NFL, so that we can check on our mental health, and we can check on our bodies and see how, if the CTE is affecting us, and how chronic pain is a part of that. So you're right, it's all hand in hand. And so that's another reason why I'm really glad that after getting clean and now coming up on my 7th year, I'm in this space of recovery where I've lived and I've walked the walk. And so I really know how to engage with people. And I want to share something. Most people think that you can either go to a drug and alcohol treatment program and you're going to get clean, and somehow you can just go home and be okay for the rest of your life. And some people think if you go to a mental illness hospital, then you're crazy. It's not true. Everybody suffers with underlying issues and mental health problems that goes into treatment. I would guess probably 80 to 90% of the people, no matter what program you go to, you're dealing with some type of mental illness that you're trying to figure out how to cope and deal with. And so that's something we do at the Vance Johnson Recovery Center, is we work with people who are dealing with a primary drug or alcohol addiction with a secondary mental health problem. And so we make sure that we have psychotherapists and therapists to spend time talking to these young men and young women, sometimes older men and older women, about the underlying issues that they're having to cope and deal with in life that cause them to use in the first place.
And another good point on that is what we're going through right now with the pandemic. I see a lot of, there seems to be a rise in depression, anxiety. You locked in your house for so long, especially when you're locked in with your significant other. You tend to get a little depressed, the anxiety starts to kick in. So I know you guys, you've taken a couple patients and you're about ready to go full swing, but have you gotten a lot of calls, a lot of emails, contact about people? You see an uptick in depression and anxiety?
It's really interesting. When this pandemic first hit, I didn't and was not prepared for how it was going to affect me emotionally and mentally. It literally shut me down when it first happened, because I wasn't able to be engaged in the recovery community like I normally was. I travel around speaking quite a bit. And so I got a little depressed myself. And my only coping back in the day with my depression and my chronic pain that I was dealing with was to try to use. So I also wasn't working out. And so my body, everything was changing, and I noticed the pain was greater. The best part about it is being in recovery. I knew that this was something that I could deal with. And so I started to focus on what was happening out in the community around the country. And so I saw the uptick on domestic violence, on athletes who were dealing with their mental health problems, and then now they're getting in trouble with drinking or using some type of drug. I start seeing things happening all over this country, knowing that it's really important for us to be transparent and break stigma and reach out to so many people. I also had never had so many people that I had even known relapse in OD. I have a friend that also had a number of people. So there's been like a total of 11 to 14 people that I've known or met that have died during this pandemic because they couldn't hold on to their recovery and ended up using drugs and dying.
Yeah, it's horrible. It's sad. Hopefully we can get over this soon. But that leads me to another question, an important question. Whether your time during the NFL and now, do you have a support system? Not only for mental health issues or your addictions or chronic pain. Do you have that? Maybe a core group or somebody you can call up, or a couple guys you call up and hang out with, and you guys can just vent about what you're going through. Do you have that support system in place?
During our career, we didn't talk about chronic pain. We didn't talk about issues that we were dealing with our home life and growing up. We were just looking for fame and we were looking for fortune. And so it was not a topic that we talked about. But after our career, every time we have alumni meetings, the only thing we talk about is chronic pain and what we're going through. So they're actually, because the NFL alumni has decided to do a little bit more, they do have different programs and resources available for us to reach out to help us with those different types of underlying issues and different injuries that we've sustained during our career to be able to cope and deal with it. We also have a thing called Fellowship of Christian Athlete, where there's about 14 former NFL ball players that we have a Zoom meeting. And so we're very transparent about what we're going through. And there are resources and even more resources now being offered through the NFL alumni and other organizations that are affiliated with the NFL to help former players deal with those injuries and long-term that they've been suffering with.
So, and another thing you read about a lot lately is veterans and what they're going through. And, especially with the post office, and a lot of veterans work at the post office. A lot of veterans rely on their medication. From what I understand, your company, Oglethorpe, you have a veterans facility in Florida, but it could be a possibility you guys are going to open up a wing at Vance Johnson Recovery Center. I think you have one opening up in Texas soon as well. Is that something you can touch on?
Well, absolutely. I've always been a really big fan of vets. My father was a vet when I was a young child. And by the way, I'm not one of those athletes that's going to kneel down when they play the national anthem. I'm that one that's going to stand up and give a football to one of those guys who are out there losing their lives just so that I can be famous. I'm sorry, I kind of got off subject, but I thought I had to say that. And so that leads me into this. I can't tell you how excited I am about the Heroes Mile program that we have, the program that we're opening up right there in Texas, and hopefully having a wing right here, because it all fits. And many people who are in the military come back home and they deal a lot with not only the chronic pain, but the mental health issues that they may have even gone to war or gone to join the service to try to deal with and cope with. Life is different when you get back home. So vets need our love and they need our help. So in fact, if anybody knows any vets that are suffering, please reach out to the Vance Johnson Recovery Center, and we'll make sure we get you to an accredited place where veterans can love on veterans and show them the way out of the bondage of the addictions or whatever they're suffering with.
Another good point you just touched on there, but I'm glad you guys are doing that for the veterans, because they need all the help they can get. But the kneeling you touched on. Now we know there's the racism in this country. If you don't believe it, you're just ignoring it. So as a black person, did you find you were treated differently? I know you're famous, so this may be a tough question for you, but let's say before the fame and you went and you had an injury and you went to the hospital and you went to the doctors, did you feel any disparities there being a black person as opposed to maybe when you became famous and you saw the privilege that comes with the fame?
I grew up around a lot of issues when it came to the race wars and blacks and whites and Mexicans and Indians. And so, but I saw it from a different vision. I didn't see the problem as a black and white thing. I saw the problem as just people wanting to overdo or outdo or use another culture. So, but I didn't take it personally. And as I grew up, I promised myself that there was no way in the world that I was going to see that there's a white person that doesn't like me or all these white people don't like me. But the only thing I did notice is as a black athlete, doctors would treat you a little bit differently. And that's only because the fathers of those black athletes, black dads, were not educating their sons to talk with them about their future, about their life, about injuries, about chronic. They weren't even talking to them about life. They were just talking to them about success and how much money you're going to make.
So aside from, you working out, you're overcoming your chronic pain, but back to your addiction, what do you think was the thing that really got you to where you wanted that help, where you wanted to stop? Because they say people won't stop until they want to stop. They need to want to stop, or they need to stop. What was it for you that got you to where this is it? I'm done. I'm not touching another drop. I'm not touching another drug. What was it that got you through that?
From the chronic pain that I suffered with after my career to the addiction problems that I had to the loss of a son because of, I blame myself not being in his life and using more and more and more. It took me literally hitting rock bottom to know that I couldn't keep living life the way I'd lived life. I'm a man of faith, and so even though I believed in God back in the day when I thought I was having all these great abilities to go out and make myself successful, I wasn't really a follower of God. So, and I hope I'm not offending anyone right now. And actually, yes, I do, because I want you to know that there's a Savior out there that's amazing, and He can get you out of this darkness. But I'm a man of faith, and when I gave myself over to my Lord and Savior Jesus Christ, then there was nothing about me anymore that I needed to use drugs or that I needed to try to cover up these pains and the different chronic pain that I was suffering with by taking more drugs or trying to figure out how to get out of it. Now I know that the whole purpose for my fall was so that I could have a platform to break stigma and offer people hope and help that are suffering out there with chronic pain and with addictions.
See, I don't think you're offending anyone. I think everybody needs to understand that everybody else has their own beliefs. Whatever your belief is your belief. Whatever my belief is my belief. And they can get along. So with that said, I understand at least one of your facilities has a Christian recovery program where they can take the faith-based approach to getting better.
What I try to tell people is this: when I travel around the country and share, when I speak at different treatment programs and I speak to people that are in recovery or in treatment, is listen, there are many, many roads to recovery, many roads to recovery. A number of us who are Christians really want to lean on our faith when it comes to our recovery. And so at the Blackberry Center, just outside of Orlando, we have an amazing Christian program there that I'm actually, even though I'm out on the West Coast, I'll be doing some devotionals on our Facebook page and also doing different live streams so that I can share hope with people who are dealing with those underlying issues. And what I do is I take biblical principles and I look at the sin and call it addiction, because it's about denying our flesh. And when you think about your flesh, what you want is to get out of how you feel. And so when you want to get out of how you feel, it doesn't make a difference whether it's a different type of drug or if it's alcohol or if it's pornography or whatever to get out of yourself. But when you starve your flesh and you know that you actually can not have to be or allow something that you're in bondage to be master over you, there's a way out. And because of my faith in Jesus Christ and knowing that He told us to bring all of our burdens and our worries and our cares to Him and lay them down and to endure the trials and the tribulations and the suffering and to carry each other's burdens, there's so many different ways in your walk, in your Christianity, that you can use that. And I'm going to call it this, and don't get offended. It's a gift. Because if you didn't have a testimony before you started using drugs or drinking or having these issues with your pornography, and now all of a sudden you're clean and you're away from that bondage, you can use that to go glorify Jesus to help somebody else who's a believer. So I don't want to start preaching at you right now, brother.
Do you feel that one person's path to recovery is different than this person's path to recovery? Or do you think they're kind of they're kind of intertwined and then they have a common denominator? Or you think just everybody's different? So you have the Christian program here, and maybe you have more of a alternative road over here. Or do you think it's one common denominator? It's just you think everybody's different there?
That's a very good question. And so I'm going to make it so that people can relate to what I'm saying. So we're all going through this coronavirus, and it's a really big problem. And for some reason, everybody thinks that we're all in the same boat. Well, we're not all in the same boat. We're all in the same storm with many different boats. Some people have money and have a home that's paid for. They have money to get food. Some people are dealing with losing their jobs, and so they're literally on a small little boat with a paddle. And some people are out there floating around because they have nothing. We're all in the same storm, but we're not all in the same boat. It's the same thing in your recovery. We're all in the same storm of struggling, but we're not all in the same boat because there are many paths through this storm that's going to get you to the other side and have a life of recovery. And so your path that fits for you is going to be the one that fits for you, but it's still going in the same direction in the same storm, but there's a way out of it.
Living with pain is often a journey with good days and bad days. If you had to pick one of each, what is your best moment and which day has been the hardest with your pain?
That's a really good question, and I'm going to be really honest with you. I wake up with pain every single day. So there's not really a good day or a bad day with pain because pain is pain. But what I am is I wake up knowing that I need to get more and more educated, more and more knowledge about how I'm going to, in the long run, deal with the pain that I'm going to be suffering with for the rest of my life. And I know a part of that is obviously staying fit, seeing a chiropractor, seeing a massage therapist, taking different types of meds, possibly for many people that are out there that can take them without being addicted. There are different ways to cope and deal with these different injuries. So my good day is knowing that I'm able to get through another day having the pain, but knowing that there are different ways and resources that I can minimize the pain and also offer that hope to somebody like you're doing with Pain Resource.
And compared to when you first started looking into the pain treatment, way back when that was, how do you feel about your treatment options? Do you prefer an older treatment, or do you feel confident with the new pain treatment strategies? So I guess what I'm getting at is that, do you like the old way you were doing it in the NFL? Probably not, since they incorporated the pain meds. Or do you like it better the way you handle it now, and you can go to the chiropractor and still work out? Which of those do you find more suits you? Old way, new way?
If I was the old me, I would go back to the old way. But I'm the new me now, and the new me is going to live a lot longer. So the new me is going to just continue to be educated, and I think that's what needs to happen, because there's a ton of education that people need to do. And I would hope somehow that we would all make this a priority in life and start really sharing hope with people that are dealing with chronic pain, so that they don't have to live in that secret and then have to figure out how to cope and deal with it. As long as you continue to get educated, there are ways to deal with that chronic pain long term so that you can have a fruitful, successful life.
What advice would you give to younger athletes who are dealing with pain from sports injuries?
So when we talk to young athletes about pain and about injuries and about long-term effects from it, they're not going to hear you. All they're going to want to know is, am I going to be healthy enough to play the next game? And what can you give me now that'll take away the pain so I can keep playing? Because I have goals, I have dreams that I want to reach. Well, we can at least plant a seed and let them know by talking with them at an early age about the injuries that they have, and about that there's going to have to be some time where they start thinking about the long-term effects with these injuries. So it's just planting seed right now. You can't change their lives, but at least you can let them be prepared.
So what advice would you give to somebody, our age, in our 40s, who are dealing with chronic pain and want to, go up the block and shoot some hoops, or they want to get out on the links and hit some golf balls?
Now, for older people that are having to deal with chronic pain, who are trying to run, who used to run for a living, or who used to run when they were kids, and now they try to do it at least to get through it, people on the golf course and people that play basketball or different types of things to stay physically fit, they need to just continue to be educated and look at different ways of how are they going to keep their bodies in shape so that they can keep doing those activities and not have worse injuries. You can't just wake up, live your life, and then go do a sport, not taking care of the way you eat, the different types of meds that you might have to look at, all different types of ways that you're going to be able to keep yourself fit. So what I did was this. I used to do bench press, and I used to lift heavy weight, and that made my muscles big. Well, now you know what I do? I use dumbbells, and I do push-ups. So I had to change my way I work out, but keep my body still physically fit.
And on a personal note, how are you holding up during all this, Vance?
I am holding up perfectly. I'll tell you what, it's been a trying time, but just like I shared with you before, like I talked to my Christian brothers and sisters, what we need to do is look at these opportunities when things are really hard to see what we can do to strengthen ourselves, but offer hope to somebody else. So I'm holding up really good, and I just can't wait to start speaking to more people around the country, which I've been doing almost every day anyway, to offer them a chance to get into treatment. Because with Oglethorpe, we have a number of programs around the country that with people that suffer with mental illness, which is a really big thing right now, and it's kind of exacerbated itself to the different drug addictions that people are suffering with. So almost every single day I'm talking to somebody. Unfortunately, a lot of people are falling off more than they're getting help, but I want to be here to help them. And me, I'm putting my hope in my walk in my Christianity, and also in offering hope to people who are suffering.
But more importantly, have you been able to get out on the golf course?
Have I been able to get out on the golf course? You want to maybe run away from this camera right now? No. And I want to go golfing. When are you going to go golfing with me?
You know, as soon as this breaks, I want to get out there. I would rather have done this in person, like I said, just you and I shooting, hitting some golf balls on the course and just having a conversation. But you know, it is what it is. But do you have guys, former players out there by you? You can go just grab the bag of clubs and just hit the links.
You know, we're friends, so when you do come out, make sure you bring your mask because you're in Florida. So, you know, I have lots of friends actually out here. In fact, one of my really good friends and one of my best friends is Randall Cunningham. He is a Hall of Famer and former Super Bowl champion MVP. Played with the Eagles for a number of years. He's also a pastor out here. Ray Lewis, Rod Woodson, who are also some other great football players who are really good friends of mine. There are a number of guys that live out here in Las Vegas, and we kind of stay in contact. And believe it or not, and don't tell any Bronco fans this, but the Raiders have just hired me to be a part of their team so that I can go check on the different guys' uniforms. I just now had to do a test this morning to make sure they can see that I'm an American citizen. But I'll be working with the Raiders to make sure the athletes are put on the proper uniforms and they're wearing them the right way and not taking different pads out or putting different signs on their bodies that they're not allowed to wear. So I'll be doing some work with the Raiders this year.
And that's great because, you know, getting back to the younger guys starting out, maybe even the older guys who are still there, they'll have somebody like you with the experience of the addiction, the chronic pain, somebody they can lean on. Hopefully they know they can. So when you start that, will you make them aware of, you know, what you've gone through, where you're at now, and how you can help? Will you welcome that that responsibility with them?
One of the main things we're going to focus on with the new Las Vegas Raiders is not only our ministry that I'll be doing under Randall Cunningham with these young men, but because I've been involved in addiction and had issues with pornography and had a lot of chronic pain, I'm that perfect resource to be able to educate these young men about being in this area, Sin City, and how there are going to be a lot of temptations for them. So I want to educate these young men so they can know that they can stay away from those things and focus more on their career and their future and their families. I'm real excited to be here because this is where I lost everything in Las Vegas. This is where I got married several times. This is where I used. This is where I had injuries because of my using and falling down. So I'm in the right place. I'm the prodigal son, and I came home to fix what I broke.
Awesome. And every clubhouse needs a guy like you, and you know, hopefully it'll save somebody down the road. But the biggest thing you got going on right now, Vance Johnson Recovery Center, VanceJohnsonRecoveryCenter.com. That phone number, 888-82-VANCE. Am I correct on that?
Yes. So people that are going to be looking to hopefully get some help, please reach out to me. You can either go to the VanceJohnsonRecoveryCenter.com. You can go to my phone number, which is a part of my football number, and that is 888, the number 82, Vance. That's 888-82-VANCE to reach out for some help, and I'm going to be there for you. I'll pick you up at the airport.
Yeah, man, as soon as I can, I'm coming out. I need to get up to New Jersey, where you're also from, correct?
Yes, I'm from upstate in Trenton, New Jersey, right there by New York, and right there where the pandemic actually took the first big blast on our country, but they're starting to get through it, hopefully at a rate that's going to be able to open the country back up, and it's something we need to really take in consideration. How are we going to open up safely so people can go back to what's going to be the new normal life?
You grew up a Steelers fan?
I actually did grow up a Steelers fan. In fact, I got a picture that I need to send to you of me and what was his name? What was the running back name? He was one.
The Immaculate Reception. I know exactly who you're talking about.
What's it?
Franco Harris. Franco Harris.
Franco Harris was my favorite running back when I was growing up, and I wanted to be just like him. And I've got a photo of me and Franco Harris actually at the Denver Bronco game a few years ago.
Well, hold on to it for when I come out. What was your favorite baseball team growing up?
My favorite baseball team growing up, actually, believe it or not, being from the East Coast, was the New York Yankees.
Same here. Hey, we got too much in common. I got to grab the club, get on a flight, come see you. Also, VanceCares.com for those of you who can't make it to Vegas. The Oglethorpe has facilities all over the country. So, Vance, I appreciate you being our first guest on here. And like I said, you're a perfect fit. We had so much to talk about. I kept you way too long. I appreciate it, and I hope to see you soon, buddy.
Brother, I appreciate it. And if people are needing some help, you can also go to VanceCares.com. I'm here to help you in any way that I can. Good talking to you, man. Good seeing you.